Welcome to Hot Girls Have Hot Takes. I'm your host, Anastasia. So, today I thought this would be a really great, appropriate topic given the fact that I am sick. So, first and foremost, apologies for. Sir, can you not? So, apologies for my nasaliness today. Somebody decided to show up to work sick, thus getting me sick, which I really appreciated. But I just wanted. Hey, do not start. So, I thought it would be a great time to bring up the topic of health insurance companies and specifically who the hell do they think they are? Because why on earth is somebody who has zero medical school experience, never took any type of medical course, has no idea about the human body scientifically, how it operates, and how the hell are these people allowed to override the treatment necessities expressed to them by medical professionals who have studied and went into hundreds of thousands of dollars of debt to help people get better, and you at some office can just put in a magical set of numbers and actually deny a life-saving claim because your company has a policy that would deem it to be an elective procedure, and then people have to go through all of these other ridiculous alternative treatments before you even decide to cover the actual treatment option, which would help better their lives and actually keep them alive and healthy. But you would rather them be on the brink of death or be dead before you ever bother to approve any claim that could actually potentially save a life. All because these freaking insurance companies are greedy as all get out, and they don't want to have to pay for someone's chemotherapy or inhaler or freaking EpiPen for that matter. Like, Lord forbid, insulin, right? Like, Lord forbid we give people these like much necessary like life-saving medications that are actually gonna, allow them to live. Oh, and then not to mention the existence of pre-existing conditions that insurance companies could deny you coverage for a quote-unquote pre-existing condition so that they don't have to cover medications going forward because it was a pre-existing condition. Like, this is batshit insane. Okay, this is the shit that pisses me off and makes me so goddamn heated. Okay, because why the hell are doctors having to spend a majority of their time fighting against some random person at an insurance company trying to beg and plead for them to appropriately approve a surgery, a procedure, a treatment that was a necessity for someone's life, and then the day of they can get they can call the doctor and say, oh, actually, we're not going to approve this treatment. Like, what the hell? What the hell? What type of super evil villain bullshit is that? What is that? Like, that is some of the most demented, like, hell is not hot enough behavior I have ever heard in my entire life. And the fact that these aren't, like, outlandish freaking options here, okay? This is not like I'm sorry, I don't think someone's asthma inhaler is a elective medicine and that they should have to go through 20 other fucking treatments that work like shit to then get to the number one best option that should have been used from the beginning that would have been cheaper for everybody in the long run. But no, y'all want to cut corners and freaking get people killed because you're little greedy overlords. Like, this is ridiculous. This is actually insane behavior. And the amount of stories that I have to hear on the news about the fact that no health insurance company gave a shit about denying these claims until big media came in and did an entire story about them, and then, oop, what was that? Oh, all of a sudden, oh, so sorry. we are going to approve the claim now. Even though, literally 3 months prior, you, like, literally 10 toes down stated, no, we're not going to cover this because it's an elective procedure. What the hell does that even mean? Do you think that certain treatments are just like shits and gigs? Like, oh, I'd love to do this, but I can't. Like, do you think people want to be sick? Do you think people want to have diabetes or asthma or cancer or all of this shit? No. And the fact that people pay for insurance and then when it's time for us to actually make a claim, y'all lose your ever-loving goddamn mind. Like, Lord forbid I submit a claim after my deductibles run up. Like, I did my part, step the F up and do your part. That's what this is for. And obviously insurance is this weird dynamic, and the reason that so many procedures are expensive is because insurance is involved, and then there's a price tack on because I guess we need, I don't understand, it's something that is so confusing to me, that something that is allegedly supposed to be there to support people, oh, is this because of Reagan? When he made health insurance companies for profit? Does it all go back to Ronald Reagan? Wow. Okay. Well, there's something. That's probably part of it, right? Okay. But anyway, the fact that we have just allowed insurance companies to, like, continuously do this ridiculous, like, bullshit is insane behavior. Like, who on earth was going to sit here and be like, you know what the American people need? Not universal health care. No, not that. No. Only privatized healthcare. But a privatized healthcare and the fact that they actually don't get any benefit from that insurance when they are incredibly sick and do need to use those benefits and need those benefits to kick in. Then all of a sudden, you know, somebody who is incredibly chronically ill is now like arguing with an insurance company because of a set of code, like medical coding billing numbers. Are we joking? Like, who do you with zero medical experience think you are trying to convince and gaslight doctors that their years of education are null and void because you have this master list of like elective procedures? I'm sorry. If a doctor says, hey, yo, this person needs this treatment or this procedure or else they'll die, you know, I think we should approve that claim, okay? Because you insurance people want your money, right? So here's how I see it, right? Actually, this doesn't even matter though, right? Which is this, God, this is so sick and twisted. I just thought about this. It doesn't even matter if that person stops breathing at the end of the day, right? If their heartbeat just, they're done, right? You know, kicked the whatever it's called and just pieced out. You know, met their maker, pearly gates, whatever, because you can just pass on the medical debt to the next living kin and continue to terrorize the family for like the end of time. That is so incredibly screwed up. Like, I swear, even like the devil may not even be as evil as that. Like, that is next level, like, insanity. And then, not to think about the fact that some insurance companies can sort of like monopolize their entire care network, right? So it's like you have the insurance company, right? But that insurance company also owns the main pharmacy. And then that means that they can then set the prices of all of the medicines within this pharmacy, which means like they kind of control how that all goes, right? So when you just basically spearhead the treatment options into one and only pathway, like what are people gonna do? Right? And these are for people who are like lucky enough to even have the option of acquiring, you know, insurance through their employer. But at the end of the day, it's like, why are we fighting and doing this when all you have to do is just approve the claim and move on? I know, everybody, capitalism, they want to make a profit. I know, okay? I'm just trying to think a bit more like, hypothetically, right? You know, like if we weren't run by a society of people who literally could not care less about people who don't make less than $1 billion in like a year, okay? So sorry for trying to like think outside the box here and trying to have like some hope for humankind. But seriously, like the hell. And then I saw this really interesting video about this. I'm not sure if she, like, I think she was an OBGYN, or she worked at like an OBGYN like office, and she was calling around um these hospitals or these clinics, and she was, excuse me, and she was asking about the cost for somebody paying out of pocket for these specific procedures. So, just like the cost of the room, the cost of the actual labor and delivery, the cost of this, the stay, the case of if they needed to have a C-section, like how would all of that actually accumulate as a cost? And it was cheaper, which was crazy. So there are a lot of self-pay discounts out there. I ran into this one time when my insurance didn't get attached when I was going to the doctor's office. But there's usually a self-pay discount for people who are like paying out of their own pocket, right? Because not everybody gets access to employer provided health insurance, and they don't have an HSA, savings card. So they do have to take this money out of their own account and then apply it to their medical expenses. And so with that, there is just a completely different set of financial burden a little bit. So I think that these discounts sort of help provide a bit of cushion, not a ton, obviously, because it's exhausting when you have to pay every single time that you go to the, excuse me. Jesus. Okay. When you have to pay every single time that you go to the doctor's office, because many times now you have to pay up front before you can get your procedure done, just for the sake of the doctor's office being, protecting themselves and making sure that they're getting payment of service before the service is provided. Very common. Even though it seems like those who pay out of pocket do pay less, the people who have to pay out of pocket probably don't have the money to pay out of pocket, if you get what I'm saying. Like, the people who have to pay out of pocket probably don't have a super high income to begin with. They probably don't have a ton of disposable. Sorry guys, I'm really struggling here. Disposable income to just shell out, $200 every time they have to go and see a doctor, right? Like, imagine if they had to go to the ER or the urgent care, like that's going to be an expensive visit for somebody to try to pay off on their own. I mean, even with insurance, like sometimes the cost is never going to be like zero in a perfect world. I remember one time I had to go to the emergency room to get a freaking COVID test because no one was open because it was New Year's Day. None of the testing centers were open, so I had to go to this freestanding ER. And before insurance kicked in, I had a bill of over $4,000. $4,000. All they gave me was like a Motrin, a flu test, and a COVID test. That was it. And they were trying to charge me $4,000. Thank God that at the time my insurance company was working with another company to try and negotiate that way the hell down. And they were able to. They got it down to like $237 or something like that. Still, personally, I think that's ridiculous. But much better than $4,000. Also, here's your advice to never go to a freestanding ER if you can help it. It's just ridiculous and unnecessary. But it's just so fascinating how, like, just trying to get healthcare in this country is like this insane maze of, it's not even a maze, it's more of like a landmine? Yeah, landmine. Minefield? I don't know. You step on the thing and it goes kaboom, right? Like, that's what I'm thinking of. But, it's like stepping on a landmine. Yeah. Right. Okay. And like, you're basically having to watch your step because you're like, ooh, if I don't do the right thing or don't say the right thing, then they can like, deny my claim. And then we're going to have to start from the beginning, even though I really do need this surgery, this treatment, this procedure, because if not, I'm literally going to die. And there's the social worker that sometimes I watch on TikTok, and his entire job is to go toe to toe with these insurance companies and call them out so hard on this bullshit practice that they have of denying life-saving claims so that they could save money. And he calls their shit out, and he's like, okay, because I have it recorded on record that you basically told this family that they had to go through 20 other generic treatments, and they went through all those 20 genetic treatments, and none of those generic treatments worked, so they actually did need the asthma inhaler of this brand that was recommended by the doctor, and then you still denied that. Well, guess what? Now that patient has suffered like an asthma attack and is now like dead. So what's good? Like, the fact that we have people advocating for these individuals is amazing, but it's the fact that we have to have people that literally their entire full-time job is going against shitty insurance companies and calling them out for their god-awful practices, because if not, there's no chain of accountability to what these insurance companies are doing to people who are literally giving them money every single month for their, coverage, right? But like, coverage doesn't matter when it comes down to it, because the second your deductible's done, now all of a sudden, oh no, we don't actually, so funny, we actually don't pay for that. Oh, actually, yeah, your colonoscopy, no, babes, you're gonna have to pay out of pocket for that one because you're not 45 and we're just like not gonna cover it. Okay, but also that's funny when colon cancer is actually rising in young adults, so obviously it makes sense that more young adults are trying to get a colonoscopy, to which I tell the people, lie. Just lie. If they ask you if you ever had a family member with colon cancer, straight up say yes. See what happens. Don't get too much into it. Because at this point, if that's what's going to get you a covered colonoscopy by these shitty insurance companies, be my guest, bro. Like, they lie to people every single freaking day. And you know what? Colon cancer is really easy to treat. When you catch it quickly, it gets a lot harder to treat the longer it advances. And also, I need y'all to eat a lot more fiber, please, and thank you, because that is also going to help with your health on that front, okay? Beans have both protein and fiber, and if you don't like beans, then I don't really know what to tell you, because the beans are the best of both worlds in this scenario. Excuse me, that was disgusting. The best of both worlds in this scenario, okay? Because now I guess we have to do whatever we can to live to be like a squeaky clean slate, so that when we are drastically ill, the insurance companies can't be like, actually, since you had the sniffles 3 weeks ago, it's pre-existing and we actually won't cover this for you. Oh, also the amount of like people who are like disabled, who like it's impossible for them to get like their motorized wheelchairs replaced when something happens to them, like feeding tubes, or that like the I don't want to say like feeding formula that some people have to take, or just any time that people become sick, like obviously they're going to need some goddamn help, which is why we are supposed to have insurance. But when insurance is hell bent on wanting sick, literally they want sick people dead. Like, that's how it's coming off, right? Like, you clearly don't want sick people to like exist in this world, so you're just going to keep denying their claims left and right so that you don't have to cover them anymore, which actually screws everybody else in the long run, because the less people on insurance means that we're paying more for insurance, which is what we're seeing with the Affordable Health Care Act, Obamacare, whatever the hell you want to call it, right? They tried to reduce that, and then the prices are like, went up for everybody because less people were covered underneath it. Like, it's all connected. It all goes together. Okay, we need people on health insurance plans so health insurance stays low, but health insurance companies, like every other corporation, are greedy as all get out and will do everything that they can to deny claims that they don't deem necessary in order to turn a profit. Now, am I saying that this is every insurance company? No, but do a lot of insurance companies need to rethink their practices and get AI out of claims? Claims review? Absolutely, because I really do think that healthcare claims need to be reviewed by human beings, okay? Because AIs can make mistakes. They can, if they alleviate certain keywords, if they flag these things, it's not going to read the entire claim. And at this point, I really do think that when it comes to people's health and wellness, we cannot be treating it like this, profit motive for a company. It is ridiculous. It is completely insensitive. It is completely irresponsible. And it's giving like eugenics a little bit, because if somebody isn't perfectly healthy, then why would we want to, take care of them? I think that's a very twisted mindset to have. I mean, like, if we're paying for insurance, If our employer is paying for insurance, if we are paying for a service, it should be provided when we need that service to be fulfilled. It's a very simple, in my brain, right? Like an A to B. And obviously, there are people in society that have gone to war against their insurance companies. They know way too much about the red tape that they're put through, about the hoops they have to jump through, about how they have to word things, getting their doctors involved, getting peer reviews involved, and I guess doctors have to peer review with somebody else sometimes to approve a treatment, and that should not be how they're spending their time, right? And the fact that doctors have to spend their time fighting insurance companies to get their patients' treatments approved is insane. Like, the doctor is the final say. Last I checked, they hold a degree in this, you don't. I mean, don't know who these insurance companies are thinking that the buck stops here. No. I mean, maybe the lawsuit starts here, baby doll, but the buck does not stop with you. Okay? So insanely infuriating, and it pisses me off so bad. And then it goes onto this, like, same point of, like, now we're mad that women aren't having more children, but, like, where's the support, babes? Like, I still have to pay hella money to give birth to this kid, right? Like, what are my benefits that I have after this kid is added to the general world population, right? Like, what if I need support to support my kid? Oh, you're not going to give me that? Oh, okay. Well, what about, like, maternity leave, right? So I can actually take care of my new kid without worrying about my job letting me go. Oh, no, we're not going to, like, make that mandatory, okay? So I have to be back at work, like, basically, if I'm lucky, like, 8 weeks after I give birth to my brand new baby. That should probably be with me for at least a month before I go back to work. But also, you don't want to subsidize daycare so that when I do have to go back to work, my child is taken care of. Because can we put daycare on insurance? I don't think we can. Which really, probably not, because, like, they're all private, right? Damn. I bet that's something people have been advocating for a while, too. You guys have to excuse the fact that I don't know a lot about the trials and tribulations of motherhood, as I am not one, but I definitely want mothers to have a better experience in society and be supported where they need to be supported, because, like, if you want children, you gotta support the people raising the children. Like, I don't see why that's such a crazy concept to me, but yeah, I think that we need to subsidize healthcare. Well, hold on, backwards. Well, yes, not a terrible, and even if, like, we still want to use, like, private healthcare, like, okay, can we rein it in a little bit? It's like, why are they allowed to deny so many claims? Like, can there be a bit more transparency of what's actually going on, like, in their noggins behind the scenes? Because it's just getting really ridiculous that people need to beg and plead with insurance companies to stay alive. And obviously, it makes sense that some people are just like, screw it, I'm not doing this anymore, and they're just gonna stop going through insurance companies and then hope and pray that they can find their medication somewhere cheaper through things like GoodRx or these other third-party pharmacies that have it at a cheaper rate. But obviously, if you have insurance, you can't use GoodRx or these other companies because it's a conflicting type of a situation, and so you're just as screwed as you were before. And I just don't like the idea or the concept that our health is controlled by private companies who kind of get the so-called final say. And they ironically don't care about anyone's health at all. The only health they care about is the health of their freaking paycheck, right? The health of their profits, their quarterly profits, their shareholders' profits. And, fight me, whatever. But honestly, I think it's just ironic that you call yourselves health insurance companies, because you don't care about any health outside of your own profits. And as long as y'all are in the green, why does it matter if someone else is fighting for their life on a ventilator and now their entire family is scrambling to figure out how they're going to pay for stuff? Yeah, at the end of the day, I really don't think that people who don't hold a medical degree somehow have the final say and who can and cannot get necessary treatment for their illnesses, ailments, overall medications they need to survive. I just think it's batshit ridiculous. But If you have any horror stories about fighting against the healthcare system, I would love to hear it. So leave it below in the comments, share with your friends, because I think this is a really big issue that has consistently been brought up and is still sort of consistently a never ending hellscape for people that have to live through it. But anyway, I have to go because I am so congested that it's not even funny. But thank you for hanging out with me. Leave your personal experiences below, and I will see you guys on the next one. Bye.